Okay, let's start.
This is a 37-year-old female who fell 8 feet off of a ladder.
Okay, as I have on scene, my PP on, is my scene safe?
Your scene is safe.
Okay, I have one patient. My MOI seems to be a lady who has fallen off of a ladder and is now laying supine on the floor. I will call it ALS, and I will have my partner hold C-spine. As I walk up to the patient and person, are they looking at me? Are they verbal?
They are.
And they're able to contact me well?
Yes.
Okay.
In pain.
In pain. Okay, so my level of consciousness is alert and verbal. My general impression is that I have, again, I didn't say that. General impression that I have a patient. I did say that. No. Again, laying supine, alert and verbal. Anyways, is there any major bleeding?
There is. There's an open right femur fracture bleeding currently.
Okay. As I look at the femur fracture, if I apply direct pressure, does it stop the bleeding?
It does not.
Okay. I will apply a tourniquet at least 2 inches above the injury. Does that stop the bleeding?
It does.
Okay. I will focus on other things right now before I put splint on it. As I come back up, is the airway patent?
The airway is patent.
What is your breathing rate, rhythm, quality?
Breathing is shallow due to pain.
Okay. And the circulation, what is the pulse rate, rhythm, quality?
124 normal rhythm.
124 normal rhythm. Okay. And I don't have any other major signs of trauma other than that leg?
Correct.
Okay. Okay. At this point, I got my blood, the pulse, and my respiratory rate. What is my blood pressure?
Blood pressure is 100/70.
Okay, and since the patient is aware, I'll ask them sample history. So you said that you just fell from the ladder?
Yes, I was painting my house.
Okay. Do you have any allergies?
No.
Any current medications?
No.
Is there any past medical history that I should be aware of?
No, not that I can think of.
Okay. When was your last thing that you ate?
Lunchtime, so like 5 hours ago.
Okay. And how long ago did this happen?
20 minutes. It hurts, please. 20 minutes. I don't know. We
Okay.
called you as soon as it happened.
Okay. At this point, I will continue to the secondary assessment. As I look at the head, do I feel any bumps or bruising or blood on the scapula?
No.
Okay. If I feel behind the ears, is there any bruising behind there?
No.
No blood coming out of the ears or fluid?
No.
Okay. If I feel around the face, the nose, mouth, and jawline area, do I have any crepitus or anything out of the ordinary?
No.
No. Nothing around the eyes either?
No.
Okay. As I feel the cervical spine, do I feel any crepitus or drop?
No.
Okay, at this point, I'll have my partner put C-spine on the patient. As I move down to the collarbones, do I feel anything?
No.
Okay. As I palpate the chest, do I feel any crepitus or movement?
No.
Okay. As I move to the abdomen, do I feel any swelling, bruising, or anything out of the ordinary?
No.
As I move to the pelvic region, is there anything for me to suspect possible trauma to the pelvic region?
No.
Okay. As I move down to the legs, other than the not splint, but the tourniquet that I have on the legs, do I have any problems?
No, pulses are strong in the left leg. Right leg has no pulses secondary to the tourniquet.
Okay, and do I have CMS in the left leg? So circulation, do I have a pulse?
Correct.
And if I tell her to push down on my hand, can they do that?
Plantar flexion is 5 out of 5.
And if I tell them to push up?
Dorsiflexion is 5 out of 5.
And can they tell me what toe I'm grabbing?
Yeah, first toe.
First toe. Okay. And since I do have that splint on, or not splint, but tourniquet on this side, I will not worry about that. However, I will put the splint on now. I'll splint joint to joint since it is a midline femur fracture. And does that stabilize it?
It does.
Okay. So move to the arms. Do I have any crepitus or instability?
No.
Okay. What about fingers?
No.
What about CMS for the hands? Pulse still there?
Pulse is 2+ in the radial artery.
Okay. Can they grip my hand?
Yes. Grip strength is 5 out of 5.
And can they tell me what finger I'm holding?
Yes, thumb.
And that's the same for both sides?
Correct.
Okay. No problems on that arm?
Correct.
Okay. At this point, I will rotate the patient based off of the count of my C-spine partner. On count of 3. 1, 2, 3. As I feel the back of the spine, do I feel any crepitus or drops?
No.
As I do a blood sweep, do I feel any blood?
No.
Okay, I'll put the backboard behind the patient and count of 3 for my partner, lower patient, 1, 2, 3. And I will transport the patient and I will monitor their both their leg and their vitals every 5 minutes in case things start to drop off, and that's it.